Good afternoon, everybody. My name is Scott McGann, doing our weekly COVID-19 update for the town of Falmouth. Today's May 7th, 2021. To get all the COVID information you need, you can go on falmouthma.gov. It's also got the links to the clinics. We'll talk about that and where vaccine can be found. Not to get a vaccine, but if you have COVID-related questions, you can either email health@falmouthma.gov or call us at 508-495-7485. There's also still the COVID hotline for the county, which is 774-330-3001, and they can help you as well. Again, we're open to everyone over the age of 16. Within the next week or two, we may see go 12 with at least one of the vaccines, I believe Pfizer. So then that may add to people that can get the vaccine. But right now, anybody over the age of 16 is eligible. We do have plenty of vaccine. We are seeing a decline in uptake of vaccine with the larger clinics. Not that people don't want it, it's just that we're not filling, 700 or 800 dose clinics. We might be getting 300 or 400, so there's plenty of vaccine available. How can you get it? Well, here's our website, and you can see where I put the two red arrows. So you can go directly to the community health center. They're using the fairgrounds and some other spots like Cape Cod Church. They've done one at the steamship. That primarily would be out of the fairgrounds. You would click there, you go to their website, and I'll show you what that looks like in a second. All the county clinics, the Barnstable County and the state clinics, you would go on the mass.gov registration, which you would just click on the Here active tab on our website, and you can get there. You go to vaxfinder.org, you get onto the pharmacies' websites, and the different pharmacies, you go directly to them to get them as well. So that's all available. There's plenty of doses around. For example, when you do click on the community health center, this is what comes up today. So it says, click here to schedule your vaccine for Wednesday, May 12th at the fairgrounds. There's going to be one on the 11th from 10 to 3, and then on the 12th from 3 to 6, which will help if you're at work. That's a Johnson & Johnson. There also may be some Pfizer as well. But you can register for a clinic there. And that is not full by any stretch, so you could get a vaccine relatively quickly if you are still seeking one. If you click on the Mass site, the other point to get pre-registered, you just follow the information on the website, fill out your information, and then you'll get a confirmation email of an appointment, and you get 24 hours of which you want to accept that appointment or not. Eventually, you're going to see the MassVax sites starting to gear down. Also, the larger clinics will start eventually gearing down even here as uptake dwindles. But for now, this is still where you're going to get it, and this would be like 4Cs. If the county did run that wasn't run by the community health center at the fairgrounds, that would be on there as well. So that's your other avenue right now. So those are the two main places, and three, pharmacies included. Pharmacies, community health center's website, or mass.gov. Where can you get a shot? You can get a vaccine in any of these stars. All the blue stars represent pharmacies. The ones that are circled represent, like for example, the fairgrounds represents the community health center working out of there. The purple would be representative of Barnstable County doing out of the 4Cs. Cape Cod Healthcare still does them. The maroon, that would be at the Melody tent. And then Outer Cape Health is using the Orleans site that was originally used by Barnstable County, circled in gray. So there's some opportunities to get vaccinated through those sites. Again, going on to the websites that I gave you to previously. Again, if you have no ability on the computer, you're vulnerable, you're having difficulty, please call the Senior Center at 508-540-0196. We still refer those people to Cape Cod Healthcare, and they'll make an appointment. All of our identified homebound have been vaccinated at this point. If you're homebound and we still do get occasional calls. If you are, we still would refer you to the community health center to get scheduled at your home for those that are homebound. So those two programs are not gone at this point, and so then take advantage of it if you fall into any of those categories. If you're having trouble getting a second dose, you can also call the health department, and we'll send your information to the Cape Cod Regional Vaccine Consortium. Basically, if you're having trouble getting Moderna, it would be Cape Cod Healthcare's done a lot with Moderna. If it's Pfizer, it would be Barnstable County Health, and then they would work with you to schedule you up for a second dose. How are we doing for vaccination rates? 66% of the county has had at least one dose, which is a 2% increase. You can see that we're up there as far as our counties go for our number that residents have had their first dose. for the entire, for having the second dose are considered fully vaccinated, one in the case of J&J after 2 weeks, it would be a 4% increase to 50%. Okay, so 50% are considered fully vaccinated. In Falmouth, this is where we are for this week. So a total of 20,935 first doses were administered to residents so far. Greater than 95% of 75 for a 1% increase. 65 to 75, 90%, another 1% increase. 50 to 64, we saw 78%, a 3% increase. 30 to 49, two-thirds done at 4% increase. Now that it's more available for young people, 20 to 29 is 54% at 5% increase, and 0 to 19, which can only be the 16 and over, 11% or 2% increase. And 51% are considered fully vaccinated. So we know that we're going to get two-thirds done. The maximum we could probably have done, because you can't have young children done vaccinated, would be somewhere around 86%. And you can see that the numbers aren't as robust because we're getting to the point where if anybody who wants a shot, especially at the older age brackets, have had plenty of opportunity to get it, and so the numbers are probably falling out to where they're going to be. And so, with vaccines, we're going to start thinking smaller clinics, making it more accessible. So maybe smaller, more frequent, maybe mobile. We're looking at different ways at which we can get another few thousand people done. We'd like to see more than 21,000 out of our 31,000 residents. It'd be nice to see another 3,000 or 4,000 done. So, at this point, we'll have to look at different ways in which to increase vaccination rates, though we are definitely above average in every which way. The county is in general. How are we doing for COVID cases? They continue to decline. We had 13 confirmed cases during the week from last Thursday to this past Thursday night. We're at 1,535 and about 13 probable cases. So we continue to do the contact tracing. Nothing in that nature has changed. The cases are down. You can tell by this chart I'm about to show you here, showing you the decline, the 1, 2, 3, 4, 5 or 6 weeks, 5 weeks of decline. We continue to decline steadily. Vaccinations are up, so the virus doesn't have as many places to go and to travel and to infect. So we're down to where we were in that sort of early fall, late summer, early fall numbers, and just like to see that continue. And that, as we go and we open up and the guidance starts to become lifted, the cases need to remain low, obviously, and they show that they are working in that way. You can see our trend. This is the flatter the line, the better. So the more flat the line is, the better. You can see it started to flatten out over the last few weeks. So that's a good sign. Positivity did stay yellow. We were really going to be close. If we have another good week, we should be green. This is a little bit of delay in the data. It's based on 2 weeks of data up to 5/1. So since we've had a really good last, 7 days or so, it's going to be reflected in next week's. We dropped from 3.54 to 2.79. I would think another drop like that, barring any sort of a spike from an outbreak or some sort of cluster. I could foresee us being green. We need about roughly 43 cases or less. I think we're at 60, grabbing the mid to late April data. So with the delay on this, with next week, this past week being good, you can see that we're having a good chance of going green next week. County stayed pretty stable at 3.4% positivity. The state's right around 2%. So we're still a little bit on the higher coming out of that, coming out of the spike that we had about a month ago. You can see the cases are declining. Our averages are in that 80s, 70s, and 8. Again, much more like we were in early November before Thanksgiving. So that's a good sign. Hospitalizations are down. We had 6 and 1. Where, roughly about a month ago, we were in the sort of 85 or so between the two hospitals. So that's definitely tailed off. Cases tail off, then hospitalizations and deaths will tail off. Statewide, we've been in the 500 to 1,000 range for the last roughly a week or so. Our positivity rate's been nice. 7-day for this particular data set was 1.37. Testing is a quicker turnaround. Less deaths. We've been in sort of between the 5 and 15 per day. Still not great, but there's a delay to that. So this is still some of the tail end of some of the cases that were and the higher counts that we had previously. About 469 people in the hospital, about 137 patients in the ICU. Those numbers continue to tail off. It did last year. If you remember this time last year, the cases started to tail off in June, July. We looked pretty good. That's even without a vaccine. It did take some time for that to happen, so it's probably just going to take a little time for those cases to drop under 500 and so forth. So You can see all the trends show a downward trend. Everything's heading in the right direction. Vaccines are heading up. As vaccinations go up, these numbers go down, which is a good sign. Testing hasn't changed. You can still get a free one. Contacting the county, Cape Cod Fairgrounds, which is the fairgrounds, or the 508-563-3200 number. You still go to, you walk in at Convenient MDs, East Falmouth CVS. Community Health also does it in Mashpee. You can also still go through the hospital as well. So the testing hasn't changed. We've always been a pretty good, solid town for testing. As far as guidance, so effective Monday, and this is an ever-changing. These things are really changing pretty fast. But a lot of our road races, large outdoor organized events are a go. Some of them will have to have submitted plans to the health department, and we've talked to some of the different larger events. Capacity is going to 25% at the arenas and ballparks. Outdoor gatherings, May 29th, we could have 200 indoor, 250 outdoor. Street festivals at 50%. Things like that are changing with the hope that we're 100% capacity with maybe some sort of, mask wearing, some sort of guidance in with it, but at least at 100% capacity by August 1st. Again, subject to public health data. If you're an organizer of an event, if you're a business, you have any questions, call the health department, give us an email, send us an email. We'll respond. I've been working with some of the different ones now over the last week or so. You definitely have a lot of them coming and contacting us. So it's complicated. Sometimes you have multiple guidances that you have to put in. Like if you're doing food service, you have the food service guidance. If you're doing theater and performances, that might be separate from the gathering that you have because there's a separate performance guidance. So it gets kind of complicated as you look. And a lot of that guidance is still very old because they won't update the website until the guidance comes into effect. So if you're about to change on May 29th, you won't see the website change with the new guidance until the 29th. So again, subject to how we're doing. This I've put on there. This is about when wear masks and when not. So fully vaccinated people, masked indoors. Not masked don't need to be outdoors unless you're crammed in there like cattle going to an event, going through, let's say, trying to get into a baseball or a football game or something like that, like a Gillette Stadium or something, then you would want it. Otherwise, indoors. And not really risky, any of the activities, because you have been vaccinated. If you haven't been vaccinated, they're saying, of course, obviously, anything indoors, restaurants, chorus, singing, worship services, movie theaters and stuff, you wear a mask and they are higher risk. Lesser of a risk if you're outside. So pretty straightforward on this. Again, cases can still occur. We still have popping up here and there. The 13 isn't a 0. So again, still, especially when indoors, if you're not feeling well, isolate yourself. Especially with the B117 variant, we do know it does spread a lot more. It does spread through households a lot more. So if one person brings it home, it definitely spreads to more people. Again, watching when you travel, reducing your travel, all the same stuff is still into effect, and you still can get it. So it's not a 0 game, it's not 0 at this point. So still be careful out there. So as a recap, everybody's eligible over 16. They may change to 12 for in the next week or two. Falmouth vaccination rates are similar to better than other Cape towns, and we're definitely doing better than a lot of the counties. Plenty of vaccine available, so take advantage. If you've been struggling, I guess the best thing I can say, if you're still struggling at this point, if you're a senior, call the senior center. If you're not a senior, you can call the health department, email the health department. But I think if you go on our website and you click on there, you shouldn't have any problems. There was plenty of open appointments for those clinics next week as of today. So again, state metrics in Falmouth resident metrics were all showing a downward trend as we would hope with the vaccinations. So that's my update for the week, and see everybody next week. Thanks.